First we will see external features of nose. See here, this is the root of the nose. This is root of the nose. This is apex of the nose. This is the dorsum of nose. Okay, and it is having the base. Base having the nostrils. So this is apex or tip of the nose, and this is the base. Base having the nostrils, the openings of anterior nasal apertures. Then here it is root. This is the dorsum. Okay, and on either side you can see the cartilaginous part and its smooth part. These are ala. Ala of the nose. These are ala of the nose. And here, this is the base, no? At the base, two nostrils are there. Two nostrils are separated by one septum. That is nasal septum. Actually, the lower part of the nasal septum, and it is covered by skin, what we are calling columella. Columella. Okay. Then below that columella here, this part is there, no? In between the columella and the upper lip. That means red line. This area what we are calling philtrum. This is philtrum. Philtrum of upper lip. Okay. So these are the external features. And here we have to discuss what are the structures which forms the roof of the nasal cavity, and what are the structures which forms the floor of the nasal cavity, what are the structures which form the lateral wall, and what are the structures which forms the medial wall or nasal septum. Right? Here we have to discuss in detail about the nasal septum and lateral wall of nose. These are very important questions. First, if you take the roof, here this is a roof. This is the roof of the nasal cavity. Roof of the nasal cavity is formed by here nasal bone. This bone what we are calling nasal bone. This is the nasal bone, and this is the nasal spine of frontal bone. This is frontal bone, and it is having the projection. So nasal spine of frontal bone. Then here it is broken actually, but here cribriform plate of ethmoid. Cribriform plate of ethmoid, and here sphenoid bone. These are the bones which are forming the roof. Of course, in the anterior most part, there will be cartilage also. Here cartilage, nasal bone, nasal spine of frontal bone, cribriform plate of ethmoid, sphenoid. These are the structures which forms the roof. Clear? Then this is floor. Floor is formed by palate. See here, this is hard palate. We know this. This is hard palate. This is only forming the floor. See here, this is the nasal cavity. This is roof. This is roof. This is only floor. So this is the floor. So this floor is formed by palate. How the palate will form? Actually, this is hard palate, and posteriorly soft palate will be there. This hard palate is formed by here two processes are coming to form the palate. These processes are belong to maxilla, and they forms the palate. So palatine process of maxilla. Two palatine process of maxilla, and here two horizontal plates, but they are belongs to palatine bone only. Horizontal plates of palatine bone. See here, these are palatine process of maxilla. They are fusing here and forming one suture in the center. And here two horizontal plates of palatine bone. They are fusing in the center. And here horizontal plate of the palatine bone and the palatine process of maxilla. They are fusing here. So that totally it becomes a cruciate suture. It is like a cross, no? It is like cross. So this suture what we are calling cruciate suture. So what I am trying to say, this palate is forming the floor for the nasal cavity. Is it? Now you know what is roof, what is floor. Right? Then what is medial wall? See here, this is the septum. This is the septum which is separating the two nasal cavities. Right and left nasal cavities are separated by nasal septum. Right? So this nasal septum, how it is formed? See here, I have removed this mucous membrane. Then I can see here, these are the bones and cartilages which are forming the nasal septum. Two bones, one cartilage. These things you have to remember very carefully. That three you have to write. Remaining structures, if you can tell, that's well and good. If you don't tell also, it's not that much worry. But three structures you have to write. One is coming down from the ethmoid. So perpendicular plate of ethmoid and vomer. Perpendicular plate of ethmoid and vomer. These are the two bones and one cartilage. That is septal cartilage. structures which forms the nasal septum. Perpendicular plate of ethmoid, vomer, and septal cartilage. Still, if you wanted to tell nasal bone, nasal spine of frontal bone, sphenoid bone, that means small contribution it is giving, sphenoid bone. Then here 3 crests. One is incisive crest, crest of maxilla, crest of palatine bone. Crest means the small projections they coming up. Nasal septum is formed by perpendicular plate of ethmoid, vomer, septal cartilage. Along with that, nasal bone, nasal spine of frontal bone, sphenoid bone, crest of palatine bone, crest of maxilla, and incisive crest. This is lined by mucous membrane that we will write. After that, what is blood supply, what is nerve supply? For our convenience, we can divide this into 4 quadrants: antero-superior quadrant, posterior-superior quadrant, antero-inferior quadrant, posterior-inferior quadrant. Right? So, like this we have divided. If you divide like this, anterior part supplied by anterior ethmoidal, here posterior ethmoidal. Then along with that, sphenopalatine, anterior ethmoidal, posterior ethmoidal, sphenopalatine. Then posteriorly and below, greater palatine. Anteriorly and below, facial, superior labial artery, branch from the facial. So, means superior labial artery, it is a branch from the facial artery. So, totally how many became? Anterior ethmoidal, posterior ethmoidal, sphenopalatine, 3. Greater palatine, superior labial, total 5. Branches of these arteries at the antero-inferior part of the nasal septum, they anastomose. There will be anastomosis of all these arteries at the antero-inferior part of the nasal septum. That area where all these arteries are anastomosed, that area what we are calling Little's area. That arterial plexus are the anastomosis of all these arteries. That plexus what we are calling Tisselbach plexus. So here Tisselbach plexus. That area is Little's area. That plexus what we are calling Tisselbach plexus. If there is any hurt or vasodilatation which leads to bleeding from this plexus. So bleeding from the nose, what we are calling epistaxis. Epistaxis is nothing but bleeding from the nose. Right? So this is blood supply. Then nerve supply. Anterior ethmoidal nerve, nasopalatine nerve. Nasopalatine nerve, and there is a nasal branches which are arising from the ganglion which is present in the pterygopalatine fossa. So pterygopalatine ganglion. From the pterygopalatine ganglion, there is a nasal branch enters into the nose. Then it will be divided into 2 branches. One is medial branch, another is lateral branch. Medial branch will supply to the nasal septum, lateral branch will supply to the lateral wall of the nose. So, how can we say this? Nerve supply to the upper part, posterior part, and medial one. And it is a nasal branch. So, posterior, superior, medial, nasal nerve or nasal branch. Correct? Posterior, superior, medial, nasal branches. Right? Posterior part. Anterior ethmoidal nerve. Then here, below and posterior. Here in this area, greater palatine nerve. Then anterior part and below. What is that? Anterior superior alveolar. Of course, anterior superior alveolar is branch from the infraorbital nerve. Infraorbital nerve is continuation of maxilla. So, what is the nerve supplying here? Anterior superior alveolar. Anterior superior alveolar. Okay. So, these are the nerve. Okay, I will repeat it. Anterior and superior quadrant. Anterior ethmoidal. Posterior and superior quadrant. Supplied by posterior, superior, medial, nasal branch from the pterygopalatine ganglion. Posterior and inferior quadrant supplied by greater palatine nerve. Anterior and inferior quadrant supplied by anterior superior alveolar nerve. So this is nerve supply. Okay. If you wanted to say the applied aspects, because of any infection or chronic cold which leads to septal deviation. Septum will be deviated towards one side, which leads to obstruction on another side. In the nasal septum, what we have discussed, how it has formed, what are the different blood vessels which are supplying to the nasal septum, what are the different nerves which are supplying to the nasal septum. Clear? So this is nasal septum finished. Now we will discuss about lateral wall of nose.